According to the World Health Organization in 2019, there were 180 million people with hearing impairment in Southeast Asia. In Indonesia, there are 5,580 people who have speech impairment or deaf. This number is 7.03% of the total people with disabilities. We, as Commis member, also conducted a survey to the preclinical student of Syarif Hidayatullah State Islamic University, Jakarta, and based on that data, the average score for sign language knowledge is only 52. Therefore, we initiate a sustainable project called Breaking the Silent to increase the knowledge and skills about history taking in sign language and also to support SDGs Point 4 and 10 and CIMSA program, which are Human Resource for Health and Human Right Equality. Our goals is to improve the knowledge and skill of 55 preclinical students of Syarif Hidayatullah State Islamic University, Jakarta in history taking with sign language-based communication by providing 4 times training on December 2021. Before the intervention, we conducted pre-intervention training for the tutor, which are the medical students that have joined this project for 2 years. The intervention was held on December 10 to 31st, 2021 via Zoom meeting, where our target community is divided into 9 groups. During the intervention, the participants learned about alphabet, numbers, days, and how to do basic introduction, how to ask about patient complaint, past medical and family history, and also social and environmental history. To evaluate their knowledge and skills, we conducted pre and post tests and also final exam. We also follow up our target community by providing materials to the target community in PDF form and the recording via WhatsApp group. We are very thankful to Pusbisindo or Pusat Bahasa Isyarat Indonesia that helps us to train our tutors for the intervention. We are very happy that the average post-test score of the target community is beyond our target, that is 18, indicating that our activity was successful. We got positive feedback from the participant and we were having a very good time. Seeing the enthusiasm of the participant made the event deserve to be held again next time. We truly wish this event gave participant and tutor benefit and useful knowledge.
Hello CIMSA, did you know that according to the Indonesia Department of Health, the age of 1 to 5 is the golden age of children to be the nation's future gold stars. Nowadays, there are problems in elementary school children such as their growth, declining intelligence, and decreased endurance due to the lack of good nutritional fulfillment based on data from the Jember District Level Health Office. Sambarsari Sub-District has the highest child malnutrition rate in Jember. After conducting the assessment, it was found that the students of SDN Karangrejo 5 tend to have a nutritional status between good and poor or at the level of 80%. This can be seen from the body postures of the students who are mostly thin and short. Therefore, CIMSA-UNEJ presents Pokemon, program for kids through education and management on nutrition. Hence, our target community is students from 4 till 6th grade of SDN Karangrejo 5 with an age range from 9 to 12 years old, in total of 119 students. The goals that we aim through Pokemon are to increase the consumptions of balanced nutritious food for students of SDN Karangrejo 5 by 50% in 2 years calculated based on the first follow-up. Therefore, the success indicators of Pokemon are increased consumptions of balanced nutritious food by students, namely 20 days per month through monitoring cards, provide education regarding to dietary reference intake, balanced nutritious food, and a clean and healthy lifestyle to grade 4, 5, and 6 students through teleconference media Zoom. The intervention is attended by a minimum of 50 students. Post-test score of each intervention is above 70. Pokemon is a sustainable program in CIMSA-UNEJ, which focuses on nutrition for children, especially elementary school age,
that have 3 interventions.
The first intervention was about 4 pillars of nutrition delivered by Himagizi. The second intervention was about how to improve self-confidence given by UNEJ Mengajar. At last,
In the third intervention,
it was about vaccines and coronavirus, which was directly delivered by CIMSA-UNEJ. To ensure that Pokemon is running well, we conduct a few methods for evaluation and follow-up. The evaluation is carried out by pre-test and post-test evaluation from organizing committee. And to follow out the program, we conduct direct interviews with stakeholders, send questions gradually via WhatsApp group, questionnaire, or monitoring card. Pokemon was likely to be done also because we collaborated with various external partners, which were Himagizi Universitas Jember and UNEJ Mengajar as a speaker and collaborator in making education content, also Tugamas Jember as a sponsor for intervention door prize. Finally, the impact of Pokemon can be seen by post-test value of each intervention, the statement of the head principal of the school by considering the nutrition program for the students of SDN Kanajo 5, also improving school hygiene facilities and infrastructure. This is Pokemon, and thank you, CIMSA!
Every year, around 225,700 people in Indonesia die from smoking or tobacco-related diseases. Based on the results of the assessment that we distributed to 10 WAFER cadres from SMP 7 Padang, it was obtained that WAFER cadres already knew about the harmful substances contained in cigarettes, but we also found out that cadres still lacked the knowledge about how to conduct the research. The results of the assessment found that the cadres wanted to educate other friends in an effort to improve health and reduce the number of teenage smokers. WAFER intends to increase the awareness and knowledge of students at SMP 7 Padang about the dangers of substances contained in cigarettes towards our health, increase their interest on how to conduct the research, and apply research capabilities owned by members of SCORI CIMSA-BEM FK Unand through the provision of materials, the formation of small working groups that can be measured through the increase of pre-test to post-test to 75, and the empowerment of 10 cadres from November 2021 until January 2022. 10 selected cadres from last year were further trained to have more knowledge of smoking. Compositions of the cigarette was explained using its analogous household items. The side effects secondary to smoking were explained visually using several real-life images in addition to illustrations, and we used a gradual time period to explain the benefits when smoking stops. All these topics were covered in a simple yet comprehensive presentation our members gave during the first intervention. For the second one, cadres were divided into groups and asked to put their knowledge into a poster using prepared materials as the main topics and their personal art styles as the cherry on top. Later that day, we also held an experiment by replicating the human respiratory mechanism using a plastic bottle. After one cigarette, the gas inside the bottle was pressed into a cotton to visualize the chemical substance one has. The cadres then presented each of their posters to different classes in order to reach more audiences on the third intervention. With so, the fact of how bad smoking is spreads wider. We worked together with a few external partners such as with SMP 7 Padang, Smoke Free Asian, and a lecturer specializing in anatomical pathology from Andalas University's medicine faculty in hope for a successful WAFER activity for our cadres this year. The evaluation we did was using a few methods like committee evaluation meetings, feedbacks from our related external partners and stakeholders, distribution of pre-test and post-test, and also a distribution of a post-project questionnaire to cadres on the usefulness of activities at the end of the third intervention, and following up every 2 months using WhatsApp group. To ensure the sustainability of this community development program, we remain to keep in touch and always maintain a healthy coordination with stakeholders, involve cadres since the very first intervention, improve any previous evaluations, following up regularly to cadres, and making a list of strengths, weakness, opportunities, and threats for the next implementation.
Excuse me, would you like to show me where the Amphiga is?
On the 3rd floor.
Wow, nice jacket. Where did you buy it?
Hello, this CIMSA jacket is not sold widely. If you want to get this, like join MMSA, then join Comdev ARIES. That will be cool.
What is Comdev ARIES?
You know diabetes, right?
Based on data obtained from Sedayu Bantul Health Center in 2020, there were 37 cases of diabetes mellitus in Dusun Watu, Argomulyo Village, Sedayu District, Bantul Regency. For this reason, MMSA created Komdev ARIES, or Action to Avoid Diabetes Mellitus, located in Dusun Watu, Argomulyo Village, Kecamatan Sedayu, Kabupaten Bantul, to provide education and understanding about diabetes and healthy lifestyle for 30 Dusun Watu residents. Komdev ARIES has been established since 2019 until now and is ready to continue its intervention for the next 2 years. ARIES supports the CIMSA movement with the focus on diabetes and the CIMSA non-communicable disease program. ARIES had the achievement in collaborating with Pertamina as a CSR in 2019. Until 2022, 6 Komdev ARIES interventions have been carried out with various activities such as morning exercises together, education about diabetes such as explanations of definition, complications, nutrition for diabetics, to understanding the COVID-19 vaccine for diabetics by inviting doctors from FKIK UMY. In addition, small working group activities were also held with the Dusun Watu residents, such as reading food labeling with the organizing committee to carry out cooking training with the Dusun Watu residents. We also held free blood pressure and blood sugar checks for every intervention for the Dusun Watu residents. For the past 3 years, we have succeeded in educating the Dusun Watu residents and improving their healthy lifestyle using an evaluation method in the form of increasing the average post-test score from the previous score of at least 20% and training OC skills in educating residents and conduct free health checks and follow-up on a healthy lifestyle using logbook every 3 months to Dusun Watu residents.
Hello and welcome to CIMSA News. Good day folks, ever heard about PRIMI before? Well, I'm Iksan and today be prepared to hear something that's very amazing. PRIMI is an abbreviation which stands for Parents with Premature Infants. It is a community development program made by CIMSA UNAIR which aims to provide education and to increase parental insight regarding health and care for premature babies. Based on World Health Organization statistics, Indonesia is ranked 5th in the world for the country with the highest incidence of premature births and ranked 9th for the highest rate of premature births per 100 live births. From this data, it can be seen that premature birth rate in Indonesia is still very high. Children that were born with premature are at higher risk for various developmental problems and disorders. With these prepositions, these children require high levels of attention. We spoke out about nutrition in the previous intervention. This year, PRIMI's 4th intervention goes on with the theme Developmental Stages and Movement Disorders of Premature Babies. This is followed by intervention number 5, which followed up more on sensory and motoric stimulation of preterm infants. Each intervention involves a hands-on demonstration in the form of exercises regarding the baby's movement and sensory motor skills. Moreover, online campaigns such as Reels and TikTok videos were run by our wonderful team. Continuing this report will be my colleague, Najma.
Yes, thank you, Ihsan. So the pandemic era didn't limit the opportunity for parents with premature babies to be able to learn together about the care and health of their babies. Although PRIMI interventions this year were held online, the community were still very enthusiastic to participate. In order to make sure that the materials were delivered well to the community, we use follow-up methods such as a logbook, which consists of each member of the community's progress, equipped with photos about the application of the materials from each intervention. We also held a quiz in the small intervention, where the questions were screen shared and the first member of the community that answered correctly got the point. 3 of them who got the highest point won prizes including goodie bags and some children's books sponsored by Pigeon Indonesia and Happy Bunny. As for our external partners, namely doctors from the Department of Pediatrics and the Department of Physical Medicine and Rehabilitation, RSUD Dr. Sutomo Surabaya, and the head of Perhimpunan Fisioterapi Anak Indonesia, Branch Surabaya. Reporting from the capital city of East Java, Najma Fauzia, CIMSA News.
Hi CIMSA! We would like to introduce you to improvement, improving health through prevention and management disease. Based on the Ministry of Health of the Republic of Indonesia in 2017, only 47.37% of cities in East Java implemented clean and healthy behavior. In the city of Malang itself, only 49.35% or 16,448 households implemented it. Based on the results of the assessment distributed to about 30 residents, 65% said they didn't know how to wash their hands in 6 steps. 75% of the community uses latrine disposal to flow directly into the river without a septic tank. And lastly, 50% of residents do not understand how to handle diarrhea properly. Our target from this activity are people around RW 7 Kelurahan Bareng, Kota Malang, and other 15 cadres. Their lifestyle in terms of health is considered as not good enough as they don't wash their hands sufficiently, the toilet disposal ends at the river, also houses there are too close to each other. Improvement aims to increase the knowledge of the RW 7 Kelurahan Bareng community, especially 15 cadres, on how to prevent diarrhea through the application of clean and healthy behavior with the delivery of material presented by credible speakers. Here are the indicators of success from improvement. This year, we organized 3 interventions, first and third intervention by WhatsApp group and second intervention through direct meetings with cadres. In the first intervention, our public health leader provided cadres with information about facts and myths about a clean and healthy lifestyle. While in the third intervention, we invited a nutritionist to introduce cooking strategies to prevent diarrhea. Despite using WhatsApp as a platform to deliver the materials, the cadres showed high excitement, and we also tried to increase the cadres' involvement by asking them to do challenges. In the second intervention, we held a direct meeting in RW 7 Kelurahan Bareng with activities including a discussion about healthy latrine with Dr. Ayunda Putri, followed with assisted hand sanitizer making skill. To ensure that our intervention has a long-term impact, we give pre-test and post-test regarding knowledge of the material as a form of evaluation. Not only that, but we also gave challenges as a follow-up to the intervention.
Hello CIMSA, I'm Rama, R-A-M-A from CIMSA-USU, and this video I will explain to you the activity that our local has proudly presented.
Did you know that 3 out of 10 disabled kids never attend formal school? Based on the data that Susanas in 2018 published, there are almost 140,000 disabled kids that never attend a formal school. We are also curious about the citizen knowledge and awareness about this topic. So, we did some research through Google Form surveys and social experiment in Lapangan Merdeka Medan about inclusivity in education for the disabled and the urgency behind sign language. The social experiment video is accessible to watch on CIMSA-USU Instagram. The primary data shows that society doesn't really know about inclusivity in education for the disabled and still don't know the urgency behind sign language. That is why, to increase both citizen knowledge and awareness about both of these topics, we held LOUD, Love Our Universal Diversity, that consists of several interventions. First, we did a radio campaign with one of the biggest radio channel in Medan, KIS FM, and with an inclusive organization, Yayasan KKSP, about inclusivity in education for the disabled and its urgency. It is followed by a 3-day online class called Hero with 23 Heroes that teach sign language. Did you know, in Indonesia, only the deaf are allowed to teach sign language? That is why we invited Gerkatin and GBI as our instructors in every online class. We also did an evaluation in every online class, and the results shows an increase of about 20% between pre and post test. We also held a celebration pose to celebrate the National Deaf Day on January 11, where about 30 people uploaded a sign language video celebration. For the last intervention, we did a community visit to SLBB Karya Murni Medan, a special school for deaf kids. We held a workshop there that taught the children about first aid of scratches and epistaxis. We did an evaluation too, and the results showed an increase of about 34.28% between pre and post test. We ended the community visit by donating to the school.
As for the conclusion, we achieved all our goals indicators, and it is safe for us to say that our activity is success. We hope Laut can inspire other locals to make more impactful activities and to improve our nation health. Horas!
Close your eyes and count to 14. If you're done, that's when a woman somewhere on this earth is diagnosed with breast cancer. And if you keep counting by 106 seconds, that's when a woman loses her life to cervical cancer. The incidence rate of breast and cervical cancer in Indonesia itself have reached 40.3% and 13.1%. Meanwhile, the result of our assessment shows that there are plenty of misperceptions regarding the risk factor of cervical cancer, and not to mention the fact that half of the survey respondents are not familiar with Sadari and Sudanese. Reflecting on this data, CIMSA-BEM wanted to contribute in helping to raise awareness of breast and cervical cancer early prevention through Blueberries. We realized that any form of cancer prevention through education programs needs to be inclusive. Hence why we aim to target these community groups as our participants. Our objective is to increase the knowledge on breast and cervical cancer management of people in their productive age. Through a series of interesting and engaging campaigns and events, we aim to build the willingness of each individual to learn and take preventive actions, while also promoting this topic to the others. Before empowering the others by educating them, we first enrich our knowledge with the pre-project training. The fun begins with our first online campaign, which is the Decorate the Bra Challenge, a concept we previously adopted from Walk the Walk movement. Next door, we also held a Pink Outfit Challenge and the Blueberries Quiz Filter on Instagram. And this is when the main event comes in. Blueberries Goes to School raised the subject of Breast and Cervical Cancer 101 for high school students in nutrition and cancer prevention. This topic was excellently delivered by Dr. Dita and received lots of warm appreciations from the students in the school we invited. Last but not least, we held a webinar which brought up the issue of managing breast and cervical cancer during this COVID-19 pandemic. We invited Dr. Arif and Dr. Junita as the speakers. Then, we wrapped it up with a workshop on Sadari in collaboration with Love Pink Indonesia, and this workshop also comes with a guidebook which you guys can download on this link. To evaluate this activity comprehensively, these indicators were made and we managed to achieve 97.7 of them. This evaluation was conducted by spreading pre-test, post-test, and evaluation form for each of our interventions. In addition, we did a follow-up and found that most of our participants actually do the Sadari, and there's also participants that have been vaccinated for HPV. We partnered with this organization as our official partners and several other media partners to boost our publication. Here are the impacts that we have achieved. There was a knowledge increase of 49.82% on our pre-project training, 18.85% on our roadshow, and 41.52% on our webinar and workshop. Our challenges were joined by 84 participants, and we got over 5,000 impressions for our Instagram filter. So, do you dare to choose wonder over worry?
Did you know that according to the Global Monitoring Report, Indonesia is ranked 10 out of 14 developing countries, seen from the quality of education? Not only that, data from the National Team for the Acceleration of Poverty Reduction shows that the number of children dropping out of school is 1,228,792, with the largest concentration in West Java.
Let's talk about Inside Out. CIMSA-BEM Unpad has a project called Inside Out, embracing an equality of nation child by improving our education, which is held to raise awareness of people about the importance of an equality education of each one of child in Indonesia. through campaign, webinar, talk show, infographic, and teaching series to children from Sekolah ITB Mengajar community in Cicahem about literacy and also character building. All of that is measured by an increase in pre-test and post-test on the webinar by 20%. The total average number of insight from infographic reaches 100 viewers, and also post-test scores of project assessment reach 70%.
To achieve the activity goals, we targeted a minimum of 100 people in the productive age group, which is 17 to 64, to be involved in further activities, webinars, and talk shows. And also at least 15 children aged 6 to 12 years old in Cicahem to participate in literacy learning with members of CIMSA-BEM Unpad and Sekolah ITB Mengajar. First, we held a talk show about our role to save children's education and equality as a community through Zoom meeting and live YouTube CIMSA-BEM Unpad. Then, we held a webinar about the current situation of children's education in Indonesia. We also held a teaching session to children aged 6 to 12 years who are in the Cicahem terminal area. This teaching raises literacy and character development as the main topics of the intervention. We also share an infographic to increase awareness of CIMSA-BEM Unpad Instagram followers and the general public about the importance of children's education. We also held a fundraising event to general public to participate and contribute to helping disadvantaged children in fulfilling their right to education and getting a better education. The result of this fundraising will be given in the form of educational support tools for children aged 6 to 12 years at the Cicahem terminal. Not only that, we also had a volunteer activity as a platform for public to expand their relationship as well as a form of their contribution in helping fulfill the right to education for Indonesian children. To make sure we meet the goals of this activity, here's our indicators. We evaluated our activity by we work with various external partners, namely, here are the impacts that we have achieved.
That is a glimpse about Inside Out, embracing equality of nation child by improving education. Untuk anak Indonesia bersama Inside Out.
Over the past few years, HIV/AIDS has been taking lives. Indonesia is widely known to have the third highest number of HIV/AIDS cases in Asia Pacific. These people are dying because of this life-threatening disease. The Komisi Penanggulan AIDS has declared that HIV/AIDS cases are a highlight in Yogyakarta. Skora CIMSA-UGM takes a leap of action towards this issue. We aim to improve the knowledge and awareness of the public, including sexually active couples as well as teenagers in their reproductive age, regarding negative stigmas and discrimination against ODHA. We also explain the facts about HIV/AIDS and how we as the youth can prevent, assure, and support those who get tested positive of HIV. To start our activity, Skora CIMSA-UGM members were trained by Petra and Yunala. Hoping to expand our impact, we conducted a ground campaign in Malioboro, Yogyakarta. We interviewed people there about HIV/AIDS stigmas, educated them, and closed it with a quiz-like post-test. Furthermore, we also recruited over 200 volunteers to join RETROGAIDS to educate society over 3 days. We campaigned through Instagram stories, infographics, a reaction photo/video, a talk show via WhatsApp with an ODHA from Victory Plus Yogyakarta, and a Twitter thread about PREP. We partnered with JIP and Pardoski to conduct a webinar with SKPED accreditations, garnering 419 participants. We collected 4.3 million Indonesian rupiahs through fundraising and exchanged it with 280 vitamins for stunted children with AIDS in Victory Plus Yogyakarta. Together with Pardoski and AMSA-UGM, we made poster and TikTok competitions and gained a total of 68 participants. To evaluate the success of our program, a set of indicators were made and all of them were achieved. In order to measure the impact of RETROGAIDS, our evaluation methods were done by distributing evaluation forms to webinars, TikTok, poster competition participants, OC, and external partners. For the follow-up, we gave a couple of questions regarding this activity's topic. Other than that, Skora CIMSA-UGM will publish an article about 95-95-95 as one of the follow-up methods related to the topic discussed in this activity. As we try to convey such an important and valuable message through this activity, we also gathered more and more partners to amplify our voices. In total, there were 6 external partners and 9 media partners that collaborated with us in this activity.
We believe that youth participation in this activity will be one step towards overcoming unfavorable stereotypes about ODHA. Remember that although HIV is a virus, stigma is a deadly disease.
ABC stands for Ayo Basmi COVID-19. It's a program that was held by CIMSA-BEM. Why? Because pandemic is yet to over. There are several cases in elementary school in Surakarta that makes CIMSA-BEM realize that we have to stand up to educate people around us. In this activity, we achieved several targets and goals. Our main goal is to improve the knowledge of students at SDN Ngoresan 80. We succeeded to execute the program by increasing knowledge seen from pre-test post-test, attendance of organizing committee on pre-activity training and offline at school, and conveying advocacy to the stakeholder. On pre-training, we invited Dr. Muhammad Eko Irawanto, SPKK, Chairman of the Indonesian Doctors Association (IDI) in Surakarta. We also had an air campaign using social media such as Instagram to enlarge the information. The next week, we had offline counseling with a small group to discuss a healthy lifestyle. We approached the interests of students by playing and discussing together. On the outside of the class, we held Tenda Pagi Skof, free blood pressure and glucose checkup for teachers, staffs, and parents who came to the school. After the offline activity, we held a drawing contest that was participated by 30 students with a healthy lifestyle and COVID-19 topics. On advocacy, we talked to the stakeholder hoping for the sustainability impact from our activity. The evaluation method we had were come from organizing committee's form and questionnaire. For the follow-up method, we used the offline follow-up to ensure the implementation of advocacy and drawing challenge competition. To conclude the impact of our activity, the increase of our knowledge is high for pre-training and offline consultation. This were our external partner, IDI Surakarta, SD Ngoresan 80, and Togamas Bookstore. A small group of thoughtful people who changed the world. Margaret Mead.
LATERESPON, or Love Hate Relationship Wanted on Fast Fashion, is a project for newbies of CIMSA-UNAIR batch 2021. This event is related to the Environmental Sustainability and Disaster Management Program. Fast fashion itself is a term for trendy, cheap, and quickly produced clothing. The quick and massive production causes several problems, such as big amount of waste, carbon emission, and poor condition of the laborers. Not only for the environment, but fast fashion also has a bad impact on health. Water that's contaminated with chemical textile dyes can cause health complications.
From the proactivity assessment, 80% of the respondents agree that the fast fashion issue is important. However, 34% of the respondents still didn't know about its effect. Moreover, LATERESPON supports IFMSA Global Priorities Program, Health, Environment, and Climate Change. WHO priorities the health impacts of climate and environmental change. The third and 30th point of SDG, good health and well-being, also climate action. Considering the facts and data provided, we, CIMSA-UNAIR newbies, aim to increase the awareness, knowledge, and skills of the public, newbies, and members of CIMSA-UNAIR itself through a series of activities. The target of this event is 260 newbies and members of CIMSA-UNAIR, along with 473 public people and volunteers, especially teenagers between the age 16 to 25, and the target have been achieved.
LATERESPON is separated into 3 events. We have a pre-event, main event, and post-event. Pre-event consists of an online campaign such as Instagram post that contains teasers, fact, infographic, live Instagram, etc. Our main event includes webinar, rework secondhand clothes for workshop and talk show, and the last we got a post-event. In our own series of post-events, we held a fashion show, made a videography, and carried out a photo shoot for our lookbook, which was uploaded to the online magazine Issue. We held this event to raise awareness about the bad effect of fashion show on the environment, public health, and also human rights. And we gladly did it. We achieved our goal for this event, even exceeded the target for our activity.
LATERESPON can be done without support from our external partner. We are working with Dila Prabakusuma for our live Instagram. We also work with Saya Pilih Bumi, Dr. Prihartini, Yavija Saski, Medicalians, and Dr. Clarissa for our main event activities. We also say thank you to PT Pupuk Kaltim and Pupuk Kaltim Hospital for the sponsorship. Like Emma Watson said, as consumers, we have so much power to change the world by just being careful in what we buy.
HIV or human immunodeficiency virus. Yes, a disease that we all know, but it's not only about the infection, there's a bigger problem about it. Yes, the stigma. So here we are, Skora CIMSA, proudly present our World AIDS Day 2021, Suppress the Disease, Support People Living with HIV.
A data showed from our Ministry of Health that there are a decreased number of HIV cases in 2020 than the previous year, but it is not a good sign. It is mainly caused by the decreased number of HIV testing during pandemic.
While our primary data to 171 medical students, it showed that they already have an adequate knowledge about the HIV newest issue, but they still need to improve on applying their knowledge to daily basis scenario as a future doctor.
As we can see, UNEJ set a new goal to end the HIV epidemic by 2030 through a movement called 95-95-95. This movement sets to be achieved in 2030 as the 90-90-90 global target is failed to be achieved, especially in Indonesia.
And then the COVID-19 pandemic came, which made everything worse. These are the problems that are faced by the people living with HIV. But there's a thing that we all need to remember, the stigma.
So here we are. CIMSA supported the SDGs number 3 and the 000 by WHO, proudly conducting our annual campaign, the World AIDS Day.
And then our goal is to raise the awareness and the knowledge to the society about the HIV and AIDS treatment and therapy development, especially in Indonesia, through a peer education continuum in a national scale with several interventions.
We conduct a crowdfunding, also conducting our first ever national scale social media volunteerings with peer education continuum, post several infographics and educational video. We also involved in several external collaborations and with our peak event, which is the movie screening and the public discussion.
And this is our evaluation and follow-up method in this campaign. And this is our target community.
This is what we achieved. Here is our data of what we achieved. And this is our external partners.
We also tried to conduct an advocacy with the Health Ministry of Indonesia, but we still haven't got any opportunity yet, and we're still rescheduling and keep continuing to try to advocating our data and our activity impact. World AIDS Day 2021 has come to an end, but the commemoration should not stop here. So that is all from us, Skora CIMSA.
Break the stigma, stop the discrimination, and save their rights. Thank you.
World Mental Health Day 2021. Around 792 million people in the world experienced mental health disorders in 2017. In Indonesia, based on the data from the Ministry of Health, the number of people with mental disorders in 2020 is 236 million people. Young people, especially those starting at the age of 20, often experience a form of emotional crisis in which they begin to question their life in the future, which is called a quarter-life crisis. Uncertain prognosis, regulation that affect personal freedom, and financial loss can cause emotional distress associated with the COVID-19 pandemic. This campaign aims to raise the awareness of the medical students and the general population of Indonesia, especially youth aged 20 to 30 years old, about mental health issues that focus on the challenge of the quarter-life crisis during the COVID-19 pandemic, its handling and prevention through social media campaign, webinar, online counseling programs, and a peer counselor program. The campaign is measured by social media metrics, the number of webinar participants, the number of online counseling registrants, and their feedback within 48 days.
Activity description. There were 5 main activities during this campaign. 1. Opinion poll regarding awareness and knowledge about mental health, especially quarter-life crisis to adolescents in Indonesia. 2. Social media campaign. 3. Online counseling program. 4. Webinar and talk show with the theme World Mental Health Day 2021, Youth Awareness on Mental Health. 5. Peer counseling. Indicators of success and its impacts. Opinion poll. Social media campaigns. Online consultation. Webinars and talk show. Peer counseling. 14 SCOFs CIMSA local from the target of 12 locals formed activities at the local level related to mental health starting in July 2021. Follow up.